Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hello everyone, I'm Dr. Warren. Today we're going to be talking about Lyme and brain fog, pretty big topic. So many people with Lyme disease have chronic fatigue or some kind of fatigue that's affecting them, and then lots of neurological symptoms, which many people use the word brain fog for. And the problem with brain fog from a doctor point of view and a medical point of view is we don't really study brain fog, and it's not the terms that we use in the research. So there's kind of a dissonance between doctors who go, I don't really know what you mean by brain fog, and I don't really know how to describe that in studies. Like, you can't go study brain fog. And we'll actually look at a study later that describes some of the common neurological symptoms for Lyme. And then lastly, what we'll try to do is talk about different strategies that I use with my patients to try to help their brain fog symptoms. So it's always important. We always want to be doing three things in any kind of a Lyme disease case or patient. We want to be doing something to kill the bug and or the co-infections. Remember, those co-infections are important. We want to be doing immune balancing strategies. Remember, your immune system's fighting this and losing. But also, it's very important to be offering symptom support and trying to repair the parts of the body that are being damaged in this whole process. And the most common part of the body that I'm trying to help is the brain in my practice. Now, you can have heart things, you can have joint problems, you can have all these things, but energy for the fatigue, so mitochondria and energy systems, along with brain symptoms, are probably the primary things that I'm supporting commonly in my patient population, because I get so many neurological Lyme disease cases, so you get fatigue and brain symptoms goes along with that. What is brain fog? Maybe a simple way to explain this is people say it's like memory problems or it's focus problems. It can also have trouble finding words, trouble making decisions. You'd be really surprised how many people, they show up for my front desk. They kind of put on that fake front and they'll try to look, like everything's okay. And they kind of come into my office, and as soon as the door shut, they kind of slump down and like, oh, okay, I can finally kind of stop faking it. And some people are so sick they can't fake it anymore. But one of the things I remember I had people tell me is they get angry at this brain fog. I remember I had one person, I had a female particularly, who told me, I used to have a steel trap mind. I was like, wow. She's like, and I don't anymore. It's just not there. I was like, okay. And she goes, and I hate it because, and this happens particularly with women, I think. Socially, the easiest way to play off your brain not working for most females is just to pretend you're kind of a ditz. You can smile and you can kind of, toss your hair, and most people can play it off socially okay that way. You, I think, would be surprised if you were to sit on my end of the, the desk here at the table when I'm talking to people, how many women, and guys too, but particularly how many women hate kind of having to play off socially like they're just dumb. And it's really just because their brain doesn't work, so they don't remember things, they can't recall things. And I remember this was frustrating when my wife was sick. We'd have whole conversations, and she talked to me a couple days later and have no recollection that we'd have that conversation. It was very frustrating. It was very hard to have conversations too, so we'd have conversations with, like, my wife couldn't track and follow things well. And so that was one of the hardest things, because one of the things that attracted me to my wife was we had wonderful discussions. She has a wonderful mind. She's great at problem solving. She has a passion for some of her pursuits. And, Lyme disease really hampered it's like she couldn't even cognitively process certain things. So for many people, that's the way that brain fog feels. They're tired, and it's very hard sometimes to distinguish between being physically tired, like your body's tired when you do things, and you're just mentally tired. So some people, when they talk about brain fog, just mean like it's almost like mental fatigue versus physical fatigue. But what's really hard is these symptoms can vary between each person to a large extent. I remember I was listening to Fallon, who is the director of the Columbia Research Center, where they're doing Lyme disease research. And at a certain point, they documented 218 different neurological symptoms that Lyme can cause, because it can hit all these different parts of the brain. And so on a person-to-person basis, this can look very differently. And people don't always describe it the same way, but what they'll tell you is my brain does not work right. It doesn't work right. It's like it's spinning through sludge, or it's like I'm swimming through a thick liquid, or it's like it just doesn't move right or doesn't think right, and it's not right. And they'll describe it as disorientated or balance or foggy or dumb or memory but it can come out so many different words to describe my brain does not work properly. There's a study out of Belgium, and in 2016, 2020, they did research on people who had Lyme disease. And they really looked at all their different symptoms they were having. They were tracking 6 symptoms primarily, and then they were tracking a total of 12. And in the primary grouping of 6, you have fatigue, and then you have, I think it's like joint pain and muscle pain. So you have fatigue, joint pain, muscle pain, which is pretty classic. And there'll be other articles we talk about joint pain and muscle pain. But the other ones are trying to get at this brain fog symptom. And the words they described for it were memory problems or forgetfulness, and then difficulty concentrating, and then specifically trouble finding words. And these are terms in research that doctors can kind of jump onto a little more. There's really not direct studies on brain fog because it's such a diffuse collection of symptoms. It's not something doctors can study very easily. But in this Belgium study, the neurological symptoms that they're really highlighting are memory problems, difficulty concentrating, trouble finding words. Now, I'm going to do an article in the next couple of weeks about sleep, and 2 of the symptoms they're doing in this Belgium study have to do with sleep. And we're talking about fatigue, we're often going to talk about sleep. So that's coming later in the future. Today, we're just focusing on the neurological symptoms surrounding brain fog. And what they're finding is people have these symptoms somewhat consistently. So we have this chronic fatigue, and we have this inability for the brain to work associated with Lyme. And the Belgium study is the best study I know to date, documenting all the different symptoms that Lyme's causing at a statistically different rate. And really nice to have these studies coming in, proving that these Lyme disease patients are not making it up, it's not pretend, it really is happening, and it's a real problem. And that's good to have the science backing up that this is a real problem after 25, 30 years of doctors saying it really wasn't a problem. So that's progress. Now, the other side, these studies, it tells you also they're so far away from actually solving the problem, guys. They're really just still, the studies coming out are still just proving the problem should not be ignored. So that's good and encouraging, and also, lets you know they just have a long way to go. Another thing we want to talk about when we talk about brain fog symptoms, and this is something I just had a person in my office talking about, is can you have other problems causing these symptoms, not just Lyme? And the answer is yes. So brain fog or brain dysfunction or brain inflammation can certainly come from things other than Lyme disease. So always the co-infections have their own way of causing these neurological problems. So Babesia makes the Lyme more aggressive into the nervous system. Bartonella screws up the circulatory pattern in the brain, can cause inflammation. Mycoplasma can cause brain inflammation. And then there's a variety of other things that ticks can do in the brain. That's not just all Lyme disease, right? And then besides that, sure, there's other things, chemicals, mold, BPA, and these plastics at high levels, and some of these herbicides, pesticides. There's other toxic things in the world that can cause problems other than Lyme disease. Nutrient deficiencies, such as not enough B1, not enough B9, B12, or various antioxidants or minerals can certainly cause problems. Hormone problems can cause some brain issues. For women, you really need healthy estrogen levels. For men, you really need healthy testosterone levels. And these are very important hormones that affect your brain. And so when I'm talking to any one person, we do want to make sure that we at least ask some questions, and sometimes it's necessary to go get tests to investigate those other areas. So if you have Lyme, you still need healthy hormones. You still need healthy nutrients. You still need some of these other things to be healthy. So what we do want to note is that if you are working with someone towards Lyme disease, it's important to not forget that there's other parts of the puzzle to make sure we're doing in a somewhat comprehensive way. We don't want to be so widespread that we miss everything that's not Lyme, but we also want to be focused enough to get something done. And that's always a balancing act. If we're talking about Lyme disease causing this brain fog, what can we do in order to get better? Or the Lyme disease fatigue. What can we do to get the Lyme disease fatigue better? Well, first and foremost, I would tell you that trying to do things that boost brain function or energy function while you still have the Lyme there causing problems, usually do not work in my experience. So many people ask me about neurological exercises. So if you're having brain fog or memory problems, there is a point in the program where doing exercise for your brain is very good. Doing memory games, doing puzzles, doing these mental exercises can be very good. Sudokus, you'll catch these things. Okay, you got to exercise your brain so your brain works. These things are very good. In my experience, they go much better as the neurological inflammation is coming down and you're clearing out the infections as opposed to right away. I tell people it's kind of like sending the carpenter in to fix the house that got on fire. If the house is still on fire, you're sending the carpenter in too early. So a lot of these mental exercises, which are very good, have less beneficial effects if you still have all the neurological inflammation from the infection. So calming that down first and then doing those same exercises can have a really good benefit. The other things, always fundamental for things like brain health, are definitely eating healthy food, getting regular sleep, not having the blue light and the screens late at night. If you can't exercise, movement of any kind can really help. We want to make sure we have some fundamentals in place. Are you seeing the sun? Are you getting some good food? Are you getting some sleep? These kind of things can certainly help brain. But then we really want to get at the Lyme, and we really want to try to dig that out so that your brain has a chance to heal. While we're going after the Lyme, we always want to be doing a little bit of effort on trying to help the specific symptoms. So we have to give some brain support. One of my favorite brain supporting nutrients. Well, I really like lion's mane. Lion's mane is a fabulous nerve healing, brain healing nutrient to help nerves heal. We like ginkgo. Ginkgo can really help with blood flow in the brain, can really help with some memory problems. So some people really like ginkgo. Sometimes neurological inflammation can be improved through just the natural anti-inflammatories that we have in the Lyme program, such as Japanese knotweed, which is very frequently in my Lyme disease protocols. Other brain boosting things that we can do, nutrients and things that help dopamine and help serotonin, and you can do some of these things. But a big part of this is getting the ability for you to exercise and feel good versus exercise and feel totally wiped out is a very, very important piece to give your brain a chance to function properly. So that's another thing where the brain fog and the fatigue are going hand in hand, which is why a lot of mitochondria nutrients are very important, which is why I run micronutrient testing for mitochondria on so many people, because this brain fog and this fatigue are actually on a cellular level can be extremely linked. If your cells don't have energy, your brain won't have energy, and things just don't work. And so getting some kind of a cellular nutrient test so you can know those specific nutrients to give your brain a chance. Because if you're missing B9, you can't make serotonin, dopamine, your brain won't work. If you're missing B1, you can't make energy in mitochondria. If you're missing some of these antioxidants like alpha-lipoic acid, is extremely important for liver detoxification and neurological anti-inflammatory antioxidant. That's why when people come in the office, we don't only do a Lyme disease test, and I'm almost always asking other questions about symptoms, and running some kind of a nutrient panel really helps me parse out some of these things of, I want to help your brain. I have 6, 7, 8 options on what to help your brain with. Let's pick the one that fits the best for you and then see if I can get you some relief. The best long-term solution is get rid of the thing driving the problem, which in this case is most often the Lyme disease. It is possible to feel better, have your brain work, but it's going to be best if you get rid of the thing bothering you, get rid of it, and then have the brain heal, and you can be healthy. You can do everything in life you ever wanted to do. I'm Dr. Warren. I hope you found this helpful as we talked about Lyme disease and brain fog, Lyme disease and fatigue. I'll talk to you again next time.